Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne with the Ask Dr. Payne segment, where he takes your questions and answers them live on air. This week's question, Dr. Payne, is about PRP facials and facelifts. This person has a question about what kind of doctors can do those, and maybe you can take a quick second and explain what exactly those procedures are.
Great. So PRP, or platelet-rich plasma, can be done essentially by any kind of doctor that invests some time in the training and how it is undertaken. What happens is blood is drawn from the arm vein, and then blood is spun down, and the platelet portion is concentrated into a smaller amount of the plasma. So that's where you get the term platelet-rich plasma. So that is then re-injected, and there are a couple of different indications. Much of it, in terms of the data, the scientific data on the effectiveness of it, is continuing to evolve. There's different ways it can be done. It can be done in the face, alongside facials, or with as an adjunct to laser treatments or facelift procedures or other types of less invasive treatments on the face, with the concept being that it's going to improve the youthfulness of the skin by the platelet growth factors being released when it's injected into that new tissue. Now, there is actually some data for the hair restoration indication, where they have shown that there is an enhancement in growth of hair follicles in the areas where PRP has been injected. It's not a replacement for other types of hair treatments. It's not going to make someone bald with a full head of hair, but it can be an adjunct to the other therapies. It's also been used for joint injections in the orthopedic area. We use it mainly in plastic surgery and dermatology as an adjunct to injectable fillers, or along with facelift procedures or laser treatment, things of that nature. It is not very invasive. It just involves taking some blood and some time to process the PRP to create the actual PRP product, and then to re-inject it. My take on it is there's probably some benefit. It may be modest benefit depending on the indication, but there's very little downside to it. So it's usually something that is added when people are interested in it, but we don't consider it a replacement for things like facelift surgery. I've heard people using it for breast lifts and things like that. Some of the indications I think are a little questionable, but for a lot of them, they are very reasonable, and it is a good adjunctive therapy that can be added to some of the standard treatments to enhance the overall results. And again, the data on it continues to evolve and be, studied. So that's the overview of PRP, and we do offer it in the office. It's not painful or difficult or anything like that, and we offer it for many of those same indications.
Well, thank you, Dr. Payne. And if you have a question for the doctor, please visit our website or Facebook page, Twitter, or Instagram. And Dr. Payne, we appreciate your time, and we'll see you on the next question.
Great.